Hello, friends. Welcome to our YouTube channel, SLP Sanjay Kumar, Voice Therapist. And we are live here. And with me, and Navraj is here. And Navraj is having some voice problem. His voice is like a childish voice and girlish voice, or we can say feminine voice. And today we are live before treatment. And today date is 15th of December 2020. So, Navraj, say about your problem, why you contacted us.
I contacted her because of my family concern.
Yeah,
And
tell in more details about yourself, your problem. Yeah.
my name is Nurul Chitri. I am from Bhutan. I am 19-year old and I am facing this problem from my puberty. Sir.
Okay. Tell your hobbies.
My hobby is to play games, play basketball, play online games, and also read books.
Okay. And because of this problem, what challenges you are facing in your day-to-day life?
Speaking in communities,
Mm-hmm.
speaking with friends, communicating with soulmate, and also
So when you talk to the unknown people on the phone, what happens?
mm, they call madam, sir.
Okay. And tell something more about yourself, like your hobbies, you are studying which class, your friends.
I'm
Means we need to talk more and more.
Yes, sir. I'm studying in sir, 12th grade. Sir.
Mm-hmm.
I've done 12 last year. I've done 12. Now I'm planning to join college sir, in India.
Okay.
So
Mm-hmm.
here, sir, just now we are facing a lockdown. Sir.
Mm-hmm.
There is lockdown. That's why I couldn't visit your hospital.
Okay. So because of the lockdown, you plan for the online therapy.
Yes, sir.
Okay. And when you talk on the phone, what happens when you talk on the phone to the unknown people?
So, they call me or madam, sir. They think I am a girl.
Okay. Yeah, so I will be just explaining why this problem occurs. To understand this problem, let's first understand how the normal speech production occurs. Okay, so that will give you an idea why this problem. So this kind of problem can be occur due to so many reasons. So at the end, I'll be explaining why in your case. So this problem can be due to nature has not given the sufficient mass in the length of the vocal cord. There is a tension in the vocal cord, uh, phonatory gap we call, and sometime we call some muscle tension dysphonia due to doing some wrong vocal exercise. Also, the feminine kind of voice can occur. But in your case, based on my evaluation, I can say that during puberty, mass and the length of the vocal cord must have changed in your case also. So now the pitch should be low, because before puberty, if you have seen in the guitar, the our vocal cord is like a guitar string. So before puberty, our guitar string, like our vocal cord, is a thin string, but after the puberty it become thick string. So when guitar string is thick, the pitch will be lower, is it not? So now your puberty has gone, and because of the testosterone hormone effect, your vocal cord mass got increased, length got increased. So your pitch should be lower, but because of so many years habit, you have not accepted the change which has happened during the puberty. So you may be having the normal mass of the vocal cord, normal length of the vocal cord, but you are not using whole mass and the whole length in an effective manner. So your pitch is higher. So what I will do as a voice therapist, I will try to stimulate whole mass and the whole length of the vocal cord. So once whole mass, whole length will be stimulated effectively, your pitch will reduce. Okay. So
Yes, sir.
just again, you got some idea?
Yes, sir.
Yeah. So understand that. Let's first understand how normal speech production occurs. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air. That air goes to the lungs. When we breathe out, we put the air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cord start moving like a string of a violin and guitar, and sounds will generate. Then we modify that sound into different sound with the help of our lips, tongue, jaw, teeth, palate, known as articulators. So suppose if you want to say p, both the lips are coming closer together and touching each other. When you want to say t, tongue is coming between the teeth. When you want to say k, back of the tongue is getting elevated and touching the soft palate. So during puberty, what happens? Mass of the vocal cord, length of the vocal cord increases and the pitch reduces. So when you want to say one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sound generate, we modify that sound into different sound. In one sentence, there are so many words. Each word has so many sound. Each sound has own place, own manner of articulation. So speech production is a little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency goes. So that will be reflecting in the form of a stammering or a stuttering. Some patient will be having a non-fluent speech or a stammering or a stuttering. You are not having. But if the place is wrong and manner is wrong, suppose if you want to say the, tongue should come between the teeth. The is a dental sound. When you want to say p, both the lips should come closer together and touch each other. So p is a bilabial sound. So each and every sound has own place, own manner of articulations. But for the production, if somebody is putting tongue in some different place, the sound will not be clear. So the problem will be a kind of misarticulation, mispronunciation. Okay. So depending upon the kind of problem, there can be different kind of communication disorder. But in your case, what happened? Like uh, during puberty, mass of the vocal cord, length of the vocal cord got increased due to a hormone called testosterone. So if mass will increase, length will increase, pitch reduces. Our vocal cord is a kind of string-like structure, like a guitar string. So before puberty, our string is like a thin. Vocal cord is thin. So the pitch is higher. It look like a feminine or shrill voice or childish voice. You can't differentiate before puberty male or female voice. It will be almost same. But after puberty or during puberty, in case of boys, mass of the vocal cord, length of the vocal cord increases due to a hormone called testosterone. If mass will increase, length will increase, the pitch reduces. If you have seen the guitar, thick string produces the low pitch voice. Is it not? Masculine voice. So before puberty, it was thin string, so the pitch was higher. After puberty, due to the testosterone, the vocal cord is thick, so the pitch should be lower. But in your case, why it is higher? Because from childhood to puberty, you spoke in a high pitch voice, and during puberty, mass of the vocal cord, length of the vocal cord changed. Now it's ready to produce the low pitch voice, but because of so many year habits, you have not accepted the change which has happened during the puberty. So if this is the vocal cord in your case, so you are just vibrating thin edges of the vocal cord, not whole mass and the whole length. So if you are vibrating only thin edges of the vocal cord, although you are having the thick string of the vocal cord, thick string like a vocal cord, okay, but it's behaving like a thin string. So if guitar string will be the thin, what will be happen? Pitch will be higher. So that's why your voice look like a feminine kind of voice. So what I will do as a voice therapist, I will try to stimulate whole mass and the whole length of the vocal cord, which is not vibrating effectively with the certain vocal exercise. Technically, we call it voice therapy. So once whole mass will be stimulated, whole length will be stimulated, the pitch will reduce. So this was the your case, what I spoke. But there are certain cases where the nature has not given the sufficient mass and the sufficient length. That case also the pitch will be higher. Voice will look like a feminine and high pitch kind of voice. Technically, we call it sulcus vocalis. Okay. There are certain cases the people has tried self-treatment or taken treatment for from the healthcare quacks, and they will damage the vocal cord or they will do some wrong exercise due to some communication problem. So in that case, we have also seen the high pitch voice. We have seen due to the some wrong vocal exercise, wrong technique, some people will do the vocal exercise, they will develop the phonatory gap, and in that cases also we have seen the high pitch voice. Some cases there may be hormonal issues also. Some cases, so because of the testosterone is not sufficient, then also we have seen the pitch will be higher. So the proper evaluation is very, very important from the professional, healthcare professional, not from the healthcare quacks or jhola chap doctor. Nowadays, because of the social media, there are so many healthcare quacks. They will make the YouTube channel, Facebook page, and they will write a speech therapist themselves. But to become a speech therapist, just making a social media page is not sufficient. Suppose if you want to become a pilot, so if you write the in before your name pilot, so you'll become a pilot. If you want to become
No,
an engineer, just before your name, if you write an engineer, so you'll become an engineer. Before your name, if you write the surgeon, you'll become a surgeon. So similarly, if you want to become a speech language pathologist, a speech therapist, you have to study at least 4 year bachelor in India, 2 year master, or even the PhD postdoctorate also people do. So just making a YouTube channel is not sufficient to become a speech therapist. If you go to the people, those who are healthcare quacks, there is a chances you may damage your voice and the vocal cord permanently sometime. So how you identify who is a speech therapist and who is a jhola chap or healthcare quacks? So a speech therapist will be having uh, information. They will give the information at their YouTube channel. If about you will be checked in the YouTube channel, so they will mention from where they have studied. But this jhola chap will never inform like where they have studied in about section of the YouTube channel. If it is a Facebook also, they will not mention. So where they have studied, just try to find out which college, which university, which year, and if they are from India, are they registered in the Rehabilitation Council of India, RCI, or not? If they have registered, what is the registration number? If you have a doubt, you can ask. But if they are working in some good hospital, good clinic, so there is no need, because once they will show all this information, then only they will get the job. But those who are just promoting in the social media something, it's you should inquire that. Otherwise, you may damage your vocal cord and the voice sometime permanently, because nowadays this is the time of social media, and everybody is just writing the those who are not having the employment, they are unemployed and they're just trying to do something, but it's not good. Healthcare quacks are damaging health of many people, so you should be very careful. And my introduction is my name is Sanjay Kumar. By profession, I am a speech language pathologist and audiologist. I have studied from AIIMS New Delhi, All India Institute of Medical Science, New Delhi. There I have done my graduation in speech and hearing science. Post graduation I have done from the University of Mysore in the field of speech language pathology field. And my area of interest is treating voice disorder. And people can know about me at my website www.speechtherapyindia.in. So there are so many people have joined. I can see the Navraj. Now you can tell about yourself and problem again. You can repeat because some new people I can see that joined live.
so, sir, my name is Noor Chitri, and I'm from Bhutan. I'm 19 years old, and I'm facing this problem from my puberty. And I have this voice since my 15. 15. My hobby is to play guitar, ride a bicycle, play online games, and all.
Okay. So because of this problem, what are the challenges you have faced in your life? Just tell in the detail.
So lots of insults. I used to face lots of insult in school,
Okay. In what
and
way
I
people were doing this kind of?
like what happened to your voice like that, sir. That
Mhm.
type of comments I used to get.
So the some kids were making fun of you also in school day time.
No, sir, not that type, sir. They used to
Okay.
tell me, sir, what happened to you like that, sir.
Hmm.
Not that kind of direct, not that type of direct insult, sir. In a positive manner, they used to tell me, sir.
Okay. So what breakfast you had? I want to talk to you more and more so that people can hear your voice. So I'll be asking very simple question also. What
Oh, okay,
breakfast you
sir.
had in the morning?
Sir, bread and tea, sir.
Okay. What is your favorite food? Yeah, you can put it. I think clarity of sound is better.
Sir,
Slightly you can put this near to you.
Momo, sir.
Okay,
Momo.
not very close. At least you can put at this distance, not very close. Hmm. What
Momo,
breakfast you
sir.
had?
You can, that's a bread and
Okay.
tea.
And what is your favorite food?
Momo, sir.
Okay. And what lunch you had today?
Lunch, sir. I didn't eat, sir, today.
Okay, fine. So just for information, at our center we provide the voice therapy and speech therapy for the people having a communication disorder, like voice is having the feminine kind of voice. So for that also we give the speech therapy. The people having the communication problem like stammering or stuttering, हिंदी में बोलते हैं हकलाना, उसका भी हम लोग speech therapy देते हैं. The suddenly voice has gone due to some psychological reason, we call it a functional aphonia. If you don't know, you just explore our playlist having the functional aphonia. The people, those who are watching, they can explore. And for that also we provide the speech therapy. The people, those who are having the dysphonia, something wrong in the voice due to the vocal cord paralysis, for that also we provide the speech therapy. And you, if you have any communication problem, those who are watching this live, you can call us at 08042041980. If you are from India, if you are from outside India, you can call us at 918042041980. Or thank you everybody for joining. I can see the Rahul. Thank you, Ram. Thank you for joining, and Ajay Joshi. Thank you, Ajay Joshi. Namaste. और फर्स्ट अजय जी, हम आपकी वॉइस को सुनना चाहेंगे बाय परसेप्चुअल इवोल्यूशन, and then we'll try to find out what could be the reason, and if needed we can send some ask you to go for laryngoscopy, and then we'll give the feedback if we can help you online or if we're not able to help you. So my suggestion is that Ajay Joshi, you can call us at 08042041980 tomorrow after 10 o'clock. So thank you everybody for joining. Thank you, Noraj. Thank you so much for being live, and we are here for creating awareness about the communication problem, and thank you for your support to being live. Thank you everybody. If you have any question, sir, or may problem hai. Yes, Rahul, by speech therapy you may improve. So of course speech therapy may be helping to you. So just tomorrow you can call us at 08042041980. Thank you, Rahul, for joining us and watching us. And so after speech therapy, we have seen the improvement in case of the R sound also. So, and what kind of services we provide? You can go to our YouTube channel, and you will find playlist. In the playlist, you'll find different kind of communication disorder and before and after treatment. So there you'll get an idea of how the speech therapy can help to the people, and it can change the people's lives. Okay, thank you everybody for joining us. Thank you so much. Thank you, Navraj.